Can we, ma'am? Pravina, ma'am?
Yes, you can.
Yeah. Good morning to one and all present here, and a warm welcome. The great poet and civil rights activist Maya Angelou said, I'm interested in women's health because I'm a woman and I'd be a darn fool not to be on my own side. The taboo around a woman's sexual and reproductive health has been the root of several issues that women face today and the insecurities that crawl under our skin. It's high time we learn our bodies, know their needs, and take care of them. Now I request Neha M, YRC Treasurer, to present the welcome address.
A pleasant morning to everyone. I, Sneha M, Treasurer of YRC Club of Ethiraj College for Women, take deep privilege in welcoming you all for the PCOD awareness program conducted by Youth Red Cross of Ethiraj College for Women. I firstly welcome our chief guest and speaker of the day, Dr. Tanuja Priyadarshini, DGO Obstetrics and Gynacology. We are happy to have you amidst us now. I welcome Dr. S. Kodai, Principal, Ethiraj College for Women, Dr. J. Praveena Ma'am, YRC Program Officer. I also welcome my fellow committee members, Amudini MD, the President, and Sai Swara Madhuri, the Secretary. Finally, I welcome all the YRC members who are here to attend this program online. PCOD, also abbreviated as polycystic ovarian disease, is emerging as one of the most common syndromes in today's teenagers and adult females. This program was initiated with concern to create awareness among the young minds. We hope that this will clear your views on PCOD. Thank you.
Thank you, Sneha. Now I request Dr. S. Kodai, ma'am, Principal of Ethiraj College for Women, to address the gathering.
Good morning to one and all present here. Welcome to all the participants for the webinar on PCOD awareness program. Respected chief guest of the day, Dr. Tanuja ma'am, Dr. Prasanna, and my beloved YRC students. Good morning to one and all and a warm welcome. The Youth Red Cross is a part of the Indian Red Cross Society, a voluntary humanitarian organization with a network over 100 branches throughout the country. YRC of Ethiraj College for Women aspires to inspire, encourage, and engage volunteers, Ethirajians, for the upliftment of the society. I'm very proud to record the YRC of Ethiraj College for Women actively engages in organizing and participating in rallies, workshops, seminars, walkathons, voluntary services on health, environment, awareness program. Last year, we did a yoga fest and a lot of programs like a road safety program, and health program for the students, for the staff, for the non-teaching, etc. And we also celebrated the World Health Day, Cancer Day, Blood Donation Day, Vigilance Week, etc. I'm sure that each day will be with our volunteers of Ethiraj College for Women, YRC, in our campus. The campus was actually sparkling with the volunteers of YRC, with the program officer and the teachers with us. I can proudly say that the whole atmosphere was filled with joy and happiness and also dedicated service by our volunteers of YRC. Now, even in the COVID-19 situation, if it is not possible in the campus, we are trying to do it live through the YouTube. We are doing our service through online programs. Life saving and first aid training programs were also conducted. We used to conduct camps in our campus. We are trying to do it if the new normal condition is good in the next coming year. And I thank the program officer, Dr. Prasanna, right, to take up all this, right, with a smile on her face, right, coordinating all the volunteers, right, and doing it in a very fine way. Thank you very much. I think this is the right platform to thank you also, and all the YRC volunteers. It may be the president or vice president or treasurer or secretary, right, with a smiling face, they do the service. Madam, I want to record here, right, even though they have not done their MBBS or something like that, they're almost like our healthcare workers. So I thank all of them for that, and they are creating a very good atmosphere of peace and happiness in our campus. A big thanks to all of them. And today's national webinar is on PCOD. I know the adolescent group, right, has to, right, take up these type of programs, so that there will be awareness, right, and the unknown facts can come to through. And I'm very happy to say that some of our science teachers, they are doing their research on PCOD in the different age group, for example between 18 to 22, 22 to this. So our I want to say that there is an action plan for the PCOD in our campus through research. Thank you, ma'am. Welcome. All the best and congratulations for the second webinar today on PCOD awareness program. All the best. Thank you, ma. Thank you very much.
Thank you so much, ma'am.
Thank you.
Thank you so much, ma'am. I'm sure our students will hold high the principles of YRC as well as Ethiraj College for Women.
Yes.
Now I request Aiswara Madhuri to introduce our chief guest to us.
Good morning to one and all present here. Not every girl dreams to wear a diamond necklace. Few dream for a stethoscope too. Today, we have with us Dr. Tanuja Priyadarshini, one such an aspirant who should be one of our role models. Tanuja ma'am did her MBBS and her post-graduation in Obstetrics and Gynacology from Andhra Medical College. She is now working as a consultant at Tirumala Vijaya Hospital, Visakhapatnam. Tanuja ma'am is not just a doctor, but also a public speaker. She has delivered a lot of guest lectures on the topics gynecology, obstetrics, and infertility. To be a doctor, one needs a lot of dedication and patience. Tanuja ma'am is one such a dedicated doctor who is also a mother of two. Your ability to balance both home and hospital is truly inspiring, ma'am. We are very happy to have you here. Thank you very much for accepting our invite despite your busy schedule. Thank you so much.
Thank you, Swaramadhuri, for that beautiful intro. And everyone has made it more easy, ma'am, because now I came to know that a large group of your students are well aware of the different basic life support. They are well aware with the health awareness programs, and your teachers too are into research. And I'm honored to be on this platform.
Yes, thank you, ma'am. Thank you.
Thank you, ma'am. Madhuri, shall we start?
Yes, ma'am.
Yeah.
Yes, ma'am, we can start.
Okay. My screen isn't visible.
No, ma'am, not yet.
Okay. It's with the share screen option you said, right?
Yes, ma'am.
Yeah, it's visible, right? Yeah.
Yes, ma'am. All good.
Yeah. So we'll start off with this. So prior to starting on creating a little bit of awareness on PCOD, I just want to ask a few questions. Just want to know how many of you have, what are the kind of options you have, what are the kind of opinions you have on PCOD. So I think there are six people available on the screen with me. So I'm taking you as a small sample group for the remaining, and I'm going to ask you a few questions. Just let me know how aware are you on PCOD, or what kind of myths or what kind of opinions you have on PCOD. So we'll start off with Swaramadhuri only because she's known to me. She's called me. So I'll start off with Swaramadhuri.
Sure, ma'am.
Yeah, yeah. So can you expand PCOD, Madhuri?
It's polycystic ovarian disorder.
So right, right. That's good. So what do you think is the main organ affected in PCOD?
Um, Uterus.
Uterus. Okay. So Amudhini, is that your name? If am I pronouncing it correctly?
Yes, ma'am, you're
Yes.
pronouncing it right.
Yes. Amodini, can you tell me what is the main organ affected in PCOD?
I guess it's the uterus or the ovaries.
Yeah, yeah, yeah. Madhuri said it is polycystic ovarian disease.
Yeah,
So,
ovaries.
why she said uterus? And you also included uterus?
Oh, yes,
When
ma'am.
it is polycystic ovarian disease, what could be the organ that is affected?
The ovaries, right.
Okay, so somehow the uterus is also nearby. Maybe it is also affected. That's it, or is
Yeah,
you think it's a unit, right? The uterus, the ovaries, they form a unit. It's a single
yeah,
unit. Yeah,
yeah,
so just like the keyboard and the mouse.
yes.
Yes.
Ma'am,
Okay.
can I raise one question, ma'am?
Yeah,
If you
yeah,
don't
sure.
mind. Ma'am, is it a disease or a disorder, ma'am? That
Yeah.
if
Yes.
you
Yes.
explain, it will be clear to all of us, ma'am. Thank you.
Sure, sure, sure. That is, we have PCOS and PCOD. So PCOS is polycystic ovarian syndrome, and PCOD is polycystic ovarian disease. So I'll let you know, ma'am, throughout the session. You'll be knowing what's the difference between the syndrome, the disorder, and the disease. And Amodini and Sneha, can you tell me what are the problems people with PCOD usually present with?
I'm being a victim. I'll tell what the problems
Yeah.
I face. I The first thing is we'll have irregular
Yes.
periods, basically, and then for some people they may become obese, they may gain weight. For some,
Yeah.
they may lose weight also.
Yeah.
Other than that, hormonal changes
Okay.
are the
So
main
you say
cause.
irregular periods and weight gain, right? Then, since
Yes,
principal
ma'am.
ma'am is gonna leave, ma'am, can you tell me what else problems can PCOD people face? If principal ma'am is not available, Pravina ma'am.
Ma'am, you didn't unmute yourself.
Oh, I'm sorry. I'm sorry. One minute.
No, 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 not Tanuja, ma'am. I'm saying Ravina, ma'am.
Acha, acha, Pravina.
Yeah.
Okay. Yeah.
Actually, I feel that those girls are highly stressful. They don't have a mental balance between what they do and how their body works, and that is highly stressful
Yes.
for them.
So, ma'am, what do you think? So, you think stress is one symptom of PCOD?
Yeah,
Huh.
absolutely. I have faced.
Yes, ma'am. So, ma'am, apart from girls, like I've asked three girls now about PCOD. So, I'm asking a woman. So, what do you think PCOD can do in women?
I think those people will be infertile. I don't know whether I'm right or wrong, but PCOD can make a woman infertile, I believe.
Yes, exactly, exactly. So this is why I asked three girls and one woman about PCOD because PCOD is not just a disorder that is there in girls or in adults. It is something which affects a girl right from her menarche till her menopause. So, menarche is the onset of menstruation, and menopause is the stoppage of menstruation. So, any woman in the reproductive age group, women includes a girl, so any woman in the reproductive age group can have PCOD. And please do remember, so PCOD is not just something to do with the ovaries or the uterus. It's a large metabolic syndrome, and most importantly, it is an endocrine disorder. So, what is endocrine? Endocrine is something that is related to the hormones, something that is related to the brain. Your pituitary releases all these hormones. So it's an endocrine disorder. It is a metabolic disorder which affects all other systems. It's not just the ovaries or the uterus. Okay, though the problem starts with the ovaries, the presentation starts with the ovaries. The problem is not with the ovaries. The presentation is in the ovaries. The problem starts in the pituitary, in the brain, and the rest of the body. The all organ systems are involved in PCOS. So that is why I'm asking two separate sects of people. One is the teenage, the adolescents, just as most of the audience are, and the rest are the adults. So the problems, the symptoms vary in both the groups. Okay. So my voice is clear, I hope. There is some background noise. Yeah. So we'll start off with the session. So as given in the introduction, it is one of the most common female endocrine disorder, and it is the leading cause for just
Ma'am,
as
sorry to interrupt, ma'am. Can you put it in the full screen, ma'am, so that the
yeah,
students in the
sure. Yeah, sure.
Ma'am, you can present it as a slideshow, ma'am.
Yeah. Shall I put it in the yeah? So that's is it fine now?
Yes, ma'am.
Yeah. Okay. So PCOD is one of the most common female endocrine disorder and is a leading cause of female obesity. So obesity and menstrual problems. That's what Sneha was telling, and infertility. That is what Pravina ma'am was saying. So that is how people with different age groups think about PCOD, and that is how they really present. So, and PCOD is polygenic. So, there are so many genes which are involved with the inheritance of PCOD. That is why, if your mother or a sister is having PCOD, it's likely that we too have PCOD. Okay. So now coming to the prevalence, so usually around 5 to 20% of women in the childbearing age group have PCOD. So in India, you will be surprised, around 36% of women are suffering with PCOS. So that is a large group. You know why? Because we are in the Asian ethnicity. Asian ethnicity has more of insulin intolerance, insulin resistance. So that is the underlying mechanism in PCOD. PCOD is largely interrelated with insulin resistance. And as Asians, we are ethnically more prone to that insulin resistance. And because of the changing lifestyles, this prevalence of PCOS is increasing both in women as well as in girls. See, as well as in girls. So, girls and women, both of them do have this problem. So, when you come to the major issues of PCOD, as everybody knows that it is something to do with the uterus and the ovaries, the problem is actually we have two ovaries, the left ovary and the right ovary, as all of you know. So, during the regular menstrual cycle, what happens is 1 month, if the left ovary releases the ovum, the next month the right ovary will release the ovum. So during the process of release of an ovum, The ovum has to undergo so many changes. Initially, it's in the form of a primordial follicle. It becomes a primary, a secondary, then it matures, and finally the ovum comes out because of ovulation. But in polycystic ovaries, that's what I'm saying. So, what is poly? Many. And what is cystic? Small fluid filled spaces, fluid filled bubbles. So they are called as cysts. So poly is many and cystic is so many small fluid filled bubbles inside the ovaries. So why are we seeing so many fluid filled bubbles inside the ovaries? That's because so in the development we find the primordial follicle becomes the primary, the secondary follicle, but it doesn't mature. There is no ovulation. There are so many secondary follicles which are arrested. They're arrested from further development. And you will find all of them are filled with fluids. So that is why on the scan you will find so many cysts in the ovaries. That is why this PCOD got its name from this polycystic ovarian morphology on ultrasound. So because in ultrasound you find so many cysts, you got the name PCOD. Okay, so I think you are a bit clear of why it is called PCOD. But do let me tell you that 26% of women with polycystic morphology on ultrasound are not PCOD. So it's not always that on the scan, if there are polycystic ovaries, it is a case of PCOD. Okay, so because there are some other criteria which have to be included in PCOD to fit a person into the group of PCOD. So please don't be alarmed when on the scan there is only polycystic ovaries. Okay, so it could be an incidental finding. It could be an incidental finding. Okay, so I told you it is a metabolic syndrome with reproductive implications. But so as I was telling, there are three criteria. There are three criteria to include any women to fit into a polycystic ovarian syndrome, and that we call it as Rotterdam criteria. Number one is androgen excess. Number two is ovulatory dysfunction. Number three is polycystic ovaries on the ultrasound. So we have, I'll explain you a little bit. I'll just brief you on this. So what is androgen excess? So androgen is normally we think that only estrogen and progesterone, they are the female hormones and only those hormones are there in females. No, we do have androgens because a small part of the ovary and a small part of the adrenals, they do release little bit of androgens inside our bodies. So every female has a little bit of androgens that are released by the ovaries and the adrenals. So with patients with PCOS, what happens is this androgen exceeds either clinically or biochemically. So how do you know that androgen is excess clinically? Clinically is they have unwanted facial hair, they have acne. Okay, so I'll elaborate on what is unwanted facial hair, what is acne, and what is biochemical androgen excess. So when you get their serum testosterone levels or their serum free testosterone levels, you find that they are more than normal. And ovulatory dysfunction. So ovulatory dysfunction is the commonest disorder with how the PCOS students present. They say either oligoovulation or anovulation. So that is, they say either their periods are irregular or they are having very little flow during their periods, or sometimes there is metrorrhagia, that is intermenstrual bleeding. So in between two periods, there is bleeding. Plus, do remember that 20% of people with PCOS have normal cycles. So it's not necessary that all PCOS patients should have irregular cycles. 20 to 30% have normal cycles. Okay. And next is the polycystic ovaries. So on the scan, if you find that at least one ovary is having more than 12 follicles, more than or equal to 12 follicles, which are less than 1 centimeter, that is between 2 to 9 mm. And the volume of at least one ovary should be more than 10 cc cube. Okay. So that is how you label it as polycystic ovaries on the scan. So, and it's not essential that all three should coexist. Any of the two can coexist together to label it as PCOS. And it's very, very important to exclude other causes of all these, because I told you, not just the ovary, it is the adrenals too that can produce the androgen. So sometimes adrenal tumors, sometimes ovarian tumors can also present with androgen excess, ovulatory dysfunction, and polycystic ovaries. So that is why we need to exclude other causes, and either any two out of these three will point towards PCOD. Okay. Yeah. So see, I told you this is the ultrasound finding. It's like a pearl of necklace, a pearl necklace. So previously, Swaramadri was saying not every girl wants to wear a diamond necklace. It is something like this. See, we talked about necklace, and there's a necklace here. So the peripherally arranged follicles, you can see the black peripheral arranged cystic spaces. So they are nothing but the follicles which are arrested. They haven't become mature, so there should be more than 12 of them. Okay, so that is the ultrasound finding. So now coming to the clinical manifestations. So I was expecting somebody would be saying acne, hair loss, and all that, hirsutism, so unwanted facial hair. So that we couldn't, nobody was able to tell that. So I'm telling you, because of the hyperandrogenism or the androgen excess, people present with acne, people present with hirsutism. So, what is acne? Acne is the simple pimples which the teenagers, adolescents usually have. And hirsutism is unwanted facial hair. It's not just unwanted facial hair. There are certain sites where male pattern distribution of terminal hair is seen. So, what is the kind of hair the females have is usually V-less type. What is V-less type? It's very small, very smooth, and very shiny. And it is non-pigmented, usually light brown, which merges with the skin color. But in hirsutism, there is male pattern type of terminal hair. So, what is terminal hair? It is rough, it is coarse, it is pigmented, and you find it in male distribution. That is under the chin, on the upper lip, in between the breasts, under the axilla. So these are all the midline hair. The midline hair is more of hirsute features. Okay. And the thing, most important thing I was telling you is insulin resistance. So the absolute feature for that insulin resistance is acanthosis nigricans. So you can see a black velvety patch, black velvety pigmented patch in the nape of your neck, that is behind the neck or in front of the neck, under your breast. That is called as the intramammillary area. Intramammillary area you find under the breast, axilla, the vulva, that is the vaginal part. So there you can find pigmented velvety patches. They are called as acanthosis, and it's a definite, absolute, sure sign of insulin resistance. And previously, a few of you said that there is obesity, there is irregular periods, there is hair loss, and there is infertility. So this is how they present. See, so these are all the things. So there is sudden weight gain and extra. What ma'am was saying, stress, that is depression, stress. So that is mood disorders are definitely a part of PCOD. So in fact, they are the least tackled problems of PCOD. So, and the thing is, I was telling you metabolic syndrome. So the blood pressure and the blood glucose levels, these two are really, really important in patients with PCOS. So see, this is acanthosis nigricans, the skin tags. So they indicate insulin resistance. This is acne. This is alopecia, that is hair loss. Usually the frontal area, the area on the above your forehead and the sides, that is called the temporoparietal area. So usually you find frontoparietal balding, that is loss of hair. See, that is usually seen in the males. So that type of androgen hair loss is seen with PCOD. Okay. Hirsutism, you've seen this. So there is excess of facial hair. And so I'm telling you, it's not just the upper lip, the beard area, the intermammary area that is in between the two breasts, the upper and the lower abdomen, the midline of the abdomen. In the vulva, there is lots of coarse hair, the axilla, and between the two buttocks, that is called the intergluteal area. So all sort of midline hair. Midline hair is indicative of hirsutism. Okay. So please do remember that if you have excess hair on your extremities, that is the upper limbs, the lower limbs, your waxing and all which you get done, that is not androgen dependent. So please don't be worried that it is androgen dependent because you have excess androgens, you're having excess hair on your arms or on your legs. So that is not totally androgen dependent. So please don't worry about that. Okay, so these are the hirsute areas. So that's what I'm saying. So there are challenges of PCOD in different age groups. So adolescents, they are more worried about acne, they are more worried about hirsutism, they are more worried about obesity and irregular periods. So what about women? They are more worried about infertility, irregular periods, obesity. And what doctors worry about PCOD? In adolescents, we worry about their future infertility. Definitely, the future infertility will pose a challenge in teenage girls with PCOD. Okay, so that is a little bit of a problem which we doctors think about. And in the women, we are worried about their poor ovarian function, their oocyte qualities, because of their high insulin and high androgen levels. So that is what they are the cream areas of interest, and they differ with adolescents, they differ with adults. So see, the teenage girl, all the teenagers which whom I've asked, they never said infertility, they never said pregnancy losses, they never said any problems in the during pregnancy. So and they are unaware. So you people are unaware about the metabolic syndrome, about the cancers it can cause. So that is why any teenage girl, and in fact that is why such a large population of young people like you need counseling, need awareness about PCOD. You have to be counseled. There are long term consequences for PCOD. There are long term consequences. So it is really important that you are aware of the underlying metabolic disorder that follows PCOD. Okay? Yeah. So now, if there is a obese PCOD girl, should she be worried about infertility? Definitely yes. Yes, she is thrice likely to be infertile. So that is what I want to project you people. It is not just infertility that is the issue. You also have the metabolic syndrome. That is why the girls, especially young people like you, should be aware of PCOD. So now what about women? Yeah, she always is bothered about the baby, the baby, the baby. So what problems does she have? One is number one, it's difficult for her to conceive. Number two, even if she conceives, she has high risk for miscarriages. She has high risk for developing diabetes during pregnancy, that is called gestational diabetes. Hypertension during pregnancy, that is called pregnancy induced hypertension, and likely to deliver before 37 completed weeks of the period, that is preterm labor. So actually it is 40 weeks the should be completed before a lady delivers, at least 37 weeks. So preterm is before 37 weeks. So before 37 weeks she is likely to deliver, that is in the 8th month, and she is likely to have IUGR or IUD. So what is IUGR? Intrauterine growth restriction. The baby is there but it's not growing. And the next thing is IUD, intrauterine demise. The baby may suddenly die inside her womb. She might carry the baby till term and then suddenly she loses the baby. So that is why PCOD has so many risks even during pregnancy. So the number one is menstrual irregularity. So usually it is delayed periods. People usually present with delayed periods or irregular periods. Sometimes there is only withdrawal bleeding. This is a problem which so many teenagers face. What is withdrawal bleeding? 2 months, 3 months, 4 months, 6 months, they have no period. They go to the doctor. We do a scan. We say, okay, she's PCOD. Fine. So we give some medication. We give progesterone. So when we give progesterone, she takes the tablet for 5 days, and after that she bleeds. That is called withdrawal bleeding. Only with the tablets she's getting period. That is called withdrawal bleeding. So, and sometimes there is absolutely no period for 6 months, no period for 1 year. Sometimes what happens, she'll present with heavy bleeding, heavy menstrual bleeding. And what's menometrorrhagia? Menometrorrhagia is in between periods, she'll be bleeding irregularly. So these are all the kind of menstrual irregularities you find in PCOD. So, and I was stressing you, 20% of PCOS have normal cycles. So please do remember that even though the cycles are normal, if clinically you are fitting into PCOS, it is PCOD. Okay. So initially, I'm seeing very early teens, that is 13, 14. These people are coming with irregular periods. So menarche is the right time when we have to counsel the patient. If those irregularities persist for 2 years after menarche, the risk for her developing PCOS is 70%. 70%. So actually, the first 1 year you can leave, because first 1 year the hypothalamo pituitary axis needs time to mature. So the first 1 year after she attains her periods, it will take her access to mature. So even if those irregularities persist for 2 years after menarche, then definitely you should counsel her, you should screen her for PCOS. Okay. Yeah. So if you look into the pathophysiology, I was telling you the underlying disorder is insulin resistance. So there is lots of insulin that is being released, but the body is not ready to accept that insulin. It's not ready. So insulin is very essential for the fat metabolism. So the adipose cells, that is the fat cells, they become resistant to insulin. Around them, there is lots of insulin. The pancreas is secreting lots of insulin, but they are not ready to take up insulin. Once they are not ready to take up insulin, what happens is that all the glucose will be accumulating. All the glucose will be accumulating. So there is hyperglycemia, there is hyperinsulinemia. So because of hyperglycemia and hyperinsulinemia, the hepatic synthesis, that is the liver synthesizes a sex hormone binding globulin. So because of that, the SHBG is reduced. So once it is reduced, testosterone is free. So testosterone actually goes hand in hand with SHBG. That is, it binds to that sex hormone globulin. So since that globulins are less, now testosterone is free. It's roaming inside your body. It's roaming freely. So that is why, because of that increased testosterone, people present with hirsutism and acne. And there is lots of disturbance with the HPO axis, that is the hypothalamic pituitary ovarian axis. So because of that, the luteinizing hormone, the follicle stimulating hormone, their ratio, everything is altered. And they present with oligo or anovulation, that is, they present with irregular cycles. And there's lots of glucose intolerance. There's hyperglycemia, and that results in dyslipidemias. So what is dyslipidemias? Dyslipidemias is the cholesterol levels, their lipid profile is altered. The cholesterol is increased, the good cholesterol is decreased, the bad cholesterol is increased, and all that results in central obesity. Central obesity is apple-shaped obesity. So the waist ratio is increased, the waist-hip ratio is increased. Okay, so all that is the underlying cause for metabolic risks. So if you look at the long-term complications, you're surprised. There is metabolic syndrome, there are cancers, there are mood disorders. So what is metabolic syndrome? So any 3 out of the 5. Actually, the average Indian lady has an 80 centimeters of waist circumference. So if you find that it has increased, the visceral abdominal fat is increased, the fasting glucose is more than 100, blood pressure is more than 130 by 85, the triglycerides and the HDL, they're a component of the lipid profile. So they are all increased. The triglycerides is increased, and HDL is the good cholesterol, high density lipoproteins. So they are reduced. So if it is less than 50 in women, so it is indicative of a metabolic syndrome. So all these people of metabolic syndrome are at increased risk for type 2 diabetes, cardiovascular diseases, strokes, fatty livers. Okay, so that's why I'm saying it's very, very important that all of you are aware of this metabolic syndrome. Okay, so any 3 out of the 5, okay, they indicate that the patient is having metabolic syndrome. So that is why we need to rule out as well as counsel the problems of all these even before we start infertility treatment. So usually the young people say only acne, hirsutism, the adult population say only infertility. They don't listen to the rest of the things, but it is very, very essential that you have to be counseled about obesity, about pre-diabetes, type 2 diabetes, insulin resistance, metabolic syndrome, hypertension, dyslipidemias, hypothyroidism, and most importantly, vitamin D deficiency. So obesity is now no longer a disorder. It has become a disease. And you'll be surprised, India is the third most obese country in the world. See? So that is because of our Asian ethnicity. It is polygenic, I told you, and it is multifactorial. So this is really scary that India is the third most obese country in the world. So if you see in PCOD women, more than 50% of them are obese. It does not mean that lean, yeah, thin people, non-obese people do not have PCOD. Definitely, there is a more difficult sect of people with PCOD. They are called lean PCOS. So lean PCOS is they are not obese, but they do have PCOD. But in 50% of the cases with PCOD, there is obesity. So this is calculated based on your BMI. So we say it's overweight if it's more than 22.5 and obese is more than 27.5. So in patients with 27.5 BMI, it's likely that they will take longer to conceive. Okay. So see the target waist circumference for Indians is 80 centimeters. That is less than 31, 32 inches. Okay. So because of too much of fat around the abdomen, we call it as apple-shaped obesity. That is an android type of obesity. The pear-shaped obesity, where the fat is deposited more in the buttocks, that is a normal gynecoid obesity. Okay, that is a normal gynecoid obesity, but this is android obesity. Android obesity is something that obesity that is more in men, that is more because of androgens. So they develop apple shaped body where the fat is more around the waist, the fat is more around the chest. So if you look at the management of obesity, first line management is simple lifestyle changes. This is the most crucial point in management of PCOD. Lifestyle changes, that is modification of diet, physical activity, and their daily habits. The second line of management is pharmacotherapy. That is only for BMIs about 24, about 27.5 with comorbidities. So that second line pharmacotherapy is usually not indicated in most of the people. And the third thing is bariatric surgery. That is for morbid obesity. Morbid obesity is with BMIs more than 32.5. So I was telling you vitamin D deficiency. So obesity is interlinked with vitamin D deficiency. Since PCOD people, 50% are obese, they do have vitamin D deficiency. That is why measuring vitamin D levels and treating vitamin D deficiency is very important in obese PCOD. And so this is one long-term complication which is most under-discussed. That is the psychosocial impacts. The psychosocial impacts of PCOD. They have poor body image, so obviously they are socially stigmatized. They have a lower rates of marriage, and few of them are socially low, socio-economically low status. So that is why this is most under-discussed, the amount of stress, the amount of poor body image feeling inside them, they all lead to anxiety, they all lead to depression. So, and this is very scary. So, we have PCOD people are at risk for endometrial cancer, are at risk for ovarian cancers, because the underlying problem with PCOD is there is estrogen also, but it is unopposed by progesterone. So it's like a policeman. The progesterone is like a policeman. If there are so many thieves, the police will come into action. But here, what is happening? There are only thieves. There is no policeman. So there is only estrogen, there is no progesterone. So estrogen is enjoying, it's creating havoc. It's making your endometrium proliferate as it wants. It's making it thicker. The endometrium is the lining inside your uterus. So that will predispose to endometrial cancers. And number two is ovarian cancer. That is because of chronic anovulation. See, so many follicles have developed, but they haven't released their ovaries. I'm sorry, they haven't released their ovums. So all these will lead to ovarian cancer. So these are the long-term risks with PCOD. So insulin resistance. So this we usually screen. We usually screen in obese people. So we usually do a fasting glucose test and an oral glucose test. So oral glucose test is we give 75 grams of glucose to the patient, and after 2 hours we do test again. So based upon the values, we screen for diabetes. We screen for diabetes in PCOD people. So, as previously told, it can lead to type 2 diabetes, cardiovascular disease, essential hypertensions, and certain forms of cancer, sleep apnea. Sleep apnea is obstructive sleep disorder, and this is because of obesity associated with PCOD. So now coming to the first line management, healthy weight loss. So at least 1 kg per week is healthy weight loss. And I'll tell you why. Why is this healthy weight loss needed? And the diet is small meals at regular intervals, include more of fruits, vegetables, whole grains, beans, fish, nuts, and seeds. Limit sugars, salt intake, avoid saturated fats and carbohydrates, early dinner. Daily moderate exercise for 40 to 60 minutes, and that will relieve symptoms of PCOS. You'll be surprised if I tell you that if you do a daily physical exercise of at least 30 minutes or 160 minutes in a week, 160 minutes in a week, you'll be surprised, really. 40% of your insulin levels go down. 40% of your insulin levels go down, 30% of your testosterone levels go down. And I'll show you one bar diagram which shows, yeah, this is Zumba fitness, whatever kind of activity you're interested, you can reduce weight. So see, look at this. This is a wonderful thing. It's very inspiring. Just 5 to 10% of your initial weight loss over a period of 6 months improves fertility outcome. See, look at this. 95% get regular cycles. I've seen this. I've seen this with so many young PCOD people. 95% of them with just 5% weight loss, they regain their regular cycles. 48% of them have spontaneous ovulation. 30% have spontaneous pregnancies and 25% have live births. See, I told you, just not the regular cycles. It's not whatever that appears outside. That is, your periods are corrected, your hirsutism is corrected, your acne is corrected, your infertility is corrected. It's not just the outside thing. The things happening inside, the metabolic disorders, the increase in insulin, the increase in androgen, they are all excellently corrected with just as little as 5% decrease in weight loss. See, that is the wonder. That is the wonder of PCOD. Everything is in your hands. Everything is in your hands. Your hands. It is you. You have to do diet restriction. It is you who have to follow regular physical activity. It's there in your hands. It's not just pharmacological treatment. It is there in your hands. Okay. So this is like for morbid obesity, it's like excessively like more than 32 of BMI, then we go for bariatric surgeries. So in the PCOD diet, green leafy vegetables are a must, which are locally available. Colored fruits and vegetables, especially the red, orange, and the greens. The colored fruit and vegetables because they're rich in antioxidants. So this antioxidants, they improve your ovulatory hormone. They improve your ovulatory endocrine environment. They change it. They change the endocrine environment of your ovaries. The nuts, the olive oil, mustard oil, the fats, these fats should be polyunsaturated fats. If the saturated fats, the trans fats, they should be avoided, and the healthy fats should include your thing, and preferably the whole grains, the whole cereals, foods with low glycemic index. So the proteins, the rajma, the chole, the whole cereals, they have lots of fiber, they have lots of protein. So these are called as alternative diet plans. The alternative diet plans, they help to maintain a sustained weight loss. The thing is, people do lose weight, but they gain it immediately. Once they stop physical activity, they regain it. So that is why you need to have a sustained diet plan. So the sustained diet plan should include foods with low glycemic index. For lean protein, the chicken, the fish. So all these is good. And foods to avoid. Avoid sugar, avoid bakeries, avoid candies, avoid dairy products like full cream, butter, cheese, unhealthy fats, caffeine, alcohol, processed foods, bread, biscuits, which usually the adolescent group tend to eat, and salt. So see, look at the dirty foods. The dirty foods are usually what we regularly take. Say all the pizzas, the burgers, the outside food, the caffeine, the hydrogenated oils, the alcohol. So these all will result the white flour and white rice. Unfortunately, for South Indians, the white rice is a staple diet. But I'm not saying it's big villain. You need to reduce your carbohydrate intake. Need to reduce your carbohydrate intake. You need not completely stop white rice. Just reduce one third of what you take. One third, not even half. One third of what you take. Okay, since it's the staple diet for Indians, especially South Indians. Actually, that is the reason for all the insulin resistance that's going on inside the body. So if you take, I'm giving you a sample diet. So early morning green tea for the for the breakfast you can have poha, oats, leafy chapatis with curd. Midday nuts, flax seeds, and fruits. Half an hour before lunch you can take salads with chapati and rajma or green leafy vegetables. Snacks you can have some fruits or some chana, some sprouts, and coconut water. And for the dinner you can have khichdi, you can have pulao mixed with lots of vegetables. Okay, so that is how it's a simple, small diet for PCOD. Okay. So since you people are more interested in this kind of thing, I was preferring to do this. And so why do you need to do exercise in PCOD? I told you. So this can improve all your clinical manifestations as well as the underlying metabolic disorders. As I already discussed this previously. So 160 minutes of exercise whenever you're free, please do that. See, look at this. You can do all kind of things. Avoid getting distracted. Do whatever you want. Do Zumba, do aerobics, do dance, do gym, go to the gym, have a brisk walk, do swimming. It's a great relaxing exercise. Yoga is recommended. So there are so many yogasanas. Maybe most of you are very well versed with yoga. I am not, but I've heard that these yogasanas are excellent for PCOD. So the butterfly pose, the Dhanurasana, the Balasana, the Chakki Chalnasana, so the lotus pose, the corpse pose, all these poses. And structured weight loss program is the key. So you don't try for self motivation. Please hire a fitness expert. Please get into some program. Please get into a group program, group weight loss program. So you can do simple things, skip an hour of TV, get off the subway a stop or a two, take the stairs, go for a walk after your lunch. So when you make your personal phone calls, this is most important. Personal phone calls, please walk. So please walk, ride a cycle. So count your steps. So we have step counters in our phone, in our mobile data. So at least 10,000 steps per day. So 70% of weight loss with diet alone and 30% of weight loss with exercise. So consistency is very, very important, and structured weight loss program only works. So remember, PCOS can't be cured. It's a lifelong disease. Once you have PCOS, you have it. You have PCOS throughout your life. But the symptoms can be managed with weight control. So if you take acne and hirsutism, usually we give oral combined pills. So this is for preventing pregnancy, but we do OCPs. We do give OCPs even to treat acne and hirsutism because they have estrogen and progesterone. So that combination works with acne and hirsutism. So with hirsutism, we give them, we do advise all this. We do advise shaving, we do advise waxing, we do advise electrolysis and laser epilation for permanent things. And there is a misconception that if you shave your hair, the next time the hair is going to be rougher, coarser, and more in amount. There is nothing like that. There is nothing like that. It is the same as waxing. Okay, and topically we have some creams like eflornithine, but the thing is, you can use it if it is very socially disturbing hirsutism. We usually prescribe it for 6 to 8 weeks, but once you stop using it, again the hair comes back. Okay, so that is the problem with this. So this is how we. So this is acne. So for acne also we give topical applications, that is creams to be applied. Creams to be applied on it, cream based treatment. And sometimes if the acne is too severe, we give them oral antibiotics. So oral contraceptive pills, and so don't worry if a doctor prescribes you oral contraceptive pills. Contraceptive pills are to avoid pregnancy. It's not just to avoid pregnancy. Since they have estrogen and progesterone, we do recommend them even in people with PCOD. So this is just to make you aware that OC pills are also used in PCOD. So out of that, in the OC pill, cyproterone is a very good drug because it has anti-androgen effects. Anti-androgen effects, especially people with hirsutism and acne, we do advise cyproterone. So the next thing is metformin. I'm just finishing off with metformin. The session will end after this information on metformin. Why I'm telling you OCPs and metformin. Why I've introduced OCPs and metformin is because when we prescribe these drugs to young people like you are alarmed. The parents are alarmed. They are like, I've seen so many parents or the young people asking me, why ma'am OC pills, I don't want to use them. They think that we've written it for pregnancy. And next thing is metformin. Metformin, I think most of you will be knowing it because either your parents or your grandparents are diabetic, and this is an anti-diabetic drug. So if I write metformin, you'll be wondering, why metformin? What is the problem? Did the doctor understand my problem? So you'll be confused. That is why I've introduced you OCPs and metformin. Metformin is a superb insulin sensitizer. It's a superb insulin sensitizer. I've told you that PCOD, the underlying disorder, is insulin insensitivity. So, just to make your body more sensitive to insulin, we give metformin. We give metformin along with antioxidants and along with OCPs. So, that is the underlying treatment, the pharmacological treatment for PCOD. But the main treatment for PCOD is exercise and diet modification. The lifestyle modification is very important. So metformin is a little bit panicky drug. So we tell them to take it half an hour before her meals so that immediately after taking it, she'll not be subjected to hypoglycemia. Her sugar levels will fall. So she has to eat something after metformin. So that is why once she's ready with the meals, half an hour before that. Initially, we'll start with a low dose of 500 mg and then we slowly increase it to 1500 mg. So this is an excellent insulin sensitizer. Okay, so excellent insulin sensitizer. So with this, we'll end the session, ma'am. I think I've covered almost everything on this PCOD. If you have any doubts, please feel free to ask. Please feel free to ask. Please feel free to interact.
Girls, start posting the question, girls, so that our team members will convey the questions to our chief guest.
Yes, please post it in the chat box, YouTube chat box. Thank you so much, Tanuja ma'am. I hope that just like me, all my other YRC fellow members have imbibed a lot of knowledge from this session. Yes, please post your feedback as well as doubts in the chat box. Ma'am, can I ask a question?
Yeah, sure.
And I have a question.
I
Oh,
too
wow.
have a question.
So,
Throughout the session, I'm surprised and I'm so thankful ma'am, that you were there for the session.
Thank you, ma'am. Thank you, ma'am.
So first, we'll start with Principal Ma'am then.
Okay, ma'am.
Even a
Ma'am,
word to it.
what is the role of
yes.
metmorphin, ma'am, in PCO? Doctors suggest metmorphin for adolescent children also. So, what is the role of metmorphin in the mechanism or metabolism?
Yeah, yes, ma'am. Because the underlying metabolism for this is androgen excess, and because of androgen excess, the testosterone levels they make the insulin resistant. So once there are lots of adipose cells, the fat cells, they uptake glucose. They have to take glucose. So that metabolism is hampered when insulin is not available. There's lots of insulin. It's just like seawater, ma'am. See, there's lots of seawater, but you can't drink it. It's just like that. So there's lots of insulin around the cells, but they can't take it. That is inhibited because they've developed resistance to insulin. So this resistance to insulin is modified with metformin. Once you give metformin, the cells are now ready to take up the glucose. So there'll not be excess of glucose, there'll not be excess of insulin outside the cells. So they're being metabolized by the cells. That is why metformin is an insulin sensitizer.
Thank you, ma'am. Thank you very much.
Yes, ma'am.
My doubt is, ma'am, you have mentioned that we should not add much ghee with our food, but usually we add much ghee with our food, and for each and everything to prepare sweets and for anything for that matter, if it is more delicious, we had to add ghee. So why it is being compartmentalized with unhealthy foods, ma'am?
Yeah. Yes, ma'am. So I'm telling you, we have two types of fats: the saturated fats and the polyunsaturated fats. Ghee is a saturated fat. So ghee is a saturated fat that has to be taken in limitation. So any balanced diet should have lipids of less than 10%. The saturated fat should be less than 3 to 6%. So you can take ghee in moderation only. You can't expect to eat lots of sweets with ghee and think it's healthy.
That's true.
You can have saturated fat because that is essential for the myelin formation. The myelin is the protective nerve sheath around the nerves, so that is needed. The saturated fat is needed, but only 3 to 6% of your diet, not more than it.
Yes. I request our students to ask questions. Yes.
Girls, you can post your questions.
Yes, ma'am. There are quite a few questions.
Yeah, you can.
The first one, yes. So they're asking, Preeti is asking, uh, is can we cure PCOD in starting
Yeah,
stage?
that's what I was telling you. PCOD is something which will once diagnosed, it's there for the rest of your lives. It's there for the rest of your lives. Even if you're 12 years, even if you're 30 years, even if you're 40 years, it's diagnosed, it's there for the rest of your lives. The main thing is just hormonal balance. You have to maintain your hormonal balance. All the clinical features will subside. So whatever problem you're having, whatever clinical problems you're having, either irregularities in your periods or the polycystic ovaries on the ultrasound or the infertility or the obesity, all the clinical features will subside if you control it and get it treated. But the disorder is always there. Once you're diagnosed, it's there for the rest of your lives.
Okay, thank you, ma'am. Another question. They are asking, can we start treatment with the doctor or just home
You
exercising is
need to
enough?
consult a doctor because once you're diagnosed with PCOD, you'll be evaluated. Suppose, like I'm telling you, it is an individualistic approach. It is different for each person. The problems are different for each person. The symptoms are different for each person. I was telling you, it's a spectrum. It's a spectrum of disorders where one person can be thin, one person can be obese, one person may have regular cycles and still have PCOS, one person may have polycystic ovaries and still not have PCOS. So that is why it is essential that they do consult a doctor. And then the main treatment, the underlying treatment is physical activity and diet. It's not pharmacotherapy. It's not with the drugs. The diet and the physical activity.
Okay, thank you, ma'am. Next question. They're asking, is there any asymptomatic PCOD found in patients?
Definitely, there is asymptomatic PCOD because I was telling you, as Asian ethnicity, most of us are underlying PCOD. See, that usually starts in the teenage with menarche only. A few people will be developing the problems with PCOD. The metabolism starts deranging, but once they are 30, they are married and they want kids, they suddenly become infertile. They're not knowing what is happening inside. So once they are screened, many of them turn out to be PCOS. So it's likely that they have regular cycles. They do not show a polycystic morphology in the ovaries, but still they have PCOS. So it's likely there are asymptomatic cases of PCOS.
Uh, Next question, ma'am. What advice would you give to patients suffering from both hyperthyroidism and PCOS?
Yeah, actually, thyroid disorders are not totally interrelated with PCOD, especially hyperthyroidism, because PCOD is more associated with hypothyroidism. So, hyperthyroidism is different, it's a different entity. Usually, hyperthyroidism is an autoimmune disorder. Autoimmune is your own body cells, they start reacting to the thyroid cells in the thyroid gland and they destroy them. So that is why most of the TSH is not released, and the free T4 levels they rise in hyperthyroidism. So it's an autoimmune disorder. So there will be these kind of patients where there is hyperthyroidism with PCOD. They present as lean PCOS. They do not have obesity. They become very thin. They become very thin and they present as lean PCOS. So their diet should be altered. They should be properly treated with hyperthyroidism. So their diet should exclude cabbage, cauliflower. So that is the cabbage, cauliflower. These vegetables they induce free thyroxine. So the free thyroxine is already high in them. So that raises further. So they should avoid such type of diets, and they should have a separate treatment plan for their hyperthyroidism. The PCOS treatment plan remains the same, even with hyperthyroidism.
Thank you, Matt. One girl is asking how to handle mood swings.
Yeah, mood swings. Right. So mood swings, I was telling you this is so under discussed, and I'm happy that this question was put up by a girl because uh, there are so many people who face this mood swing. So mood swings is basically a hormonal imbalance, and most of you, even though you don't have PCOD, you people are subject to premenstrual stress.
Yes.
PMS is there. It's there in every age group. It's there with me also. So let me make it there with me also. So the premenstrual stress is like a hormonal imbalance. So there are certain things you have to do before the period. Avoid caffeine. Avoid chocolate. Caffeine, chocolate, and foods with bloating. So any food that causes bloating, please do avoid. So once you avoid, what happens is the pain during menstruation automatically goes off. The pain during menstruation. Try to include fiber-rich diet. Fiber-rich diet is whole foods, the whole cereals. Try to take them. Try to drink lots of fluids. So all that will keep you in good mood. And third thing is the salt consumption. It has to be reduced because that leads to water retention. So there'll be lots of water retention because of that. There'll be breast tenderness, there'll be weight gain just before the period, and all that leads to your mood imbalance. So because of the physical discomfort you have prior to the period, you'll be imbalanced with your mood too. So try to modify your diet. Try to be involved physically active. Make yourself physically active. Do something because you all are in a young age group. You can do anything. You can do Zumba. You can do anything. Yoga. You can do walking. Anything, whatever you want. Okay. So please involve yourself in physical activity. Avoid caffeine. Avoid chocolates. Take high fiber content foods. So automatically your mood disorders, your mood swings do reduce. Usually pharmacological therapy is not indicated for mood disorders, especially in PCOD. PCOD, small lifestyle changes will solve the problem.
Thank you, ma'am. One last question. A few of them have asked how to prevent PCOD. Yeah, that you can be benefited. I mean, not get the disease in future. What are the preventive measures?
Preventive measures.
Preventive measures. So preventive measures is based upon your risk factors. So I told you we are the non-white group. The non-white group, as such, are prone to PCOD. So once you know that you are prone to PCOD, and number thing is family history. Family history of PCOD in your parents or your sister developing PCOD during her pregnancy. So all these are making you, they're putting you in a risk. They're putting you in a zone of risk. So that is why you should be aware that these kind of things may come on to you. So please do have lifestyle modification. That is really, really, really important. Lifestyle modification is a very difficult thing in this scenario because most of you will not be having dinner before 8 o'clock. Previously, people used to have dinner before 8 o'clock, do some work, go to sleep by 9. Now sleeping by 9 is considered so abnormal. So sleeping by 11, 12, 1 o'clock is the new normal. So that's what I'm saying. We have to get back to our previous things. We have to have a lifestyle modification. That is really, really important. And structured exercise program. That's what I'm saying. You structured exercise program is really important. We all have self motivation most of the time. See, January 1st is coming. Okay, I'll take a decision. Yeah, I'll see that I'll lose 5 kgs, I'll lose 10 kgs. It's always like this. Self motivation will never work, never work. Get yourself into a structured program so that you'll do it. Do it as a physical group activity. Do it as a group activity. Take your friends, go for walking, go for swimming, whatever you want to do. Okay, so lifestyle modification is a must. So that is a most important preventive measure.
Thank you, ma'am. Thank you, sir.
Yeah. Okay.
Ma'am,
Ma'am,
I have a
I
question.
have a question.
Okay, Sneha, you go.
Sneha. Okay, okay, Amodhini. Yeah, Amodhini, tell me.
Yeah, so As you said, PCOD, as much as it's a biological thing, it's also a mentally and emotionally crippling phenomenon, right? I know a couple of friends who have PCOD, but I don't exactly know how to communicate with them about it. And I don't want to be insensitive and say something offensive to them. So I know this question doesn't have a right answer, but how do I be a better friend to my PCOD friends?
Yes, exactly. So that's what I'm saying. People with PCOD have a poor body image. That poor body image is because of the social stigma around. So they are obese. So people around them, they start making fun. It's not necessarily that they eat lot. It's because of the underlying endocrine metabolic disturbance that they have that central obesity. So they are socially stigmatized. So if you have to be a good friend, that is why you are being aware of PCOD. That is why this program was conducted. So please don't socially stigmatize them. So help them to lose weight. In that way, your own metabolism, you can challenge your own metabolism, you can prevent it. So somebody was asking how to prevent it. So you have to prevent it by going into a group activity. Include your socially stigmatized friends in the group activity. That way, you'll be able to set proper goals for yourself too. If you're doing it with all healthy people who eat all types of junk food, you will never lose weight, you will never change your lifestyle. Do it with your socially stigmatized friends. Do it with your socially stigmatized friends. Okay, Amodita, I think you're a little bit happy.
Thank you, ma'am.
Yeah. Okay.
Thank you, Dr. Tanuja. I
Thank you,
thank
ma'am.
Dr. Pravina for having such a good program today. Right, I thank all my Ethirajians, Amudini, Sneha, Saiswara, right, for and also all the participants getting a lot of information. Ma'am, it was an excellent presentation. Thank you very much.
Thank
Thanks.
you, ma'am. Thank you. Thank you, Pravina, ma'am. Yeah. Thank you, one and all.
Once
It was
again,
nice.
once again, I would like to propose the vote of thanks. And before that, Sneha has a question.
Yes,
Yeah,
ma'am.
yeah.
Actually, she didn't finish her question. Let her finish, and I'll propose the vote of thanks.
Sure, Sneha.
Ma'am, you told we should avoid dairy products. So, is milk advisable? Can we drink milk regularly?
You can take milk. You can take milk. I was talking about fat-rich milk, the milk which is full cream. Okay, the milk with full cream should be avoided in obese PCOS. Okay, you can take milk.
Thank you, ma'am.
Yeah.
Thank you so much, ma'am. And I would like to propose a vote of thanks for this session.
Sure.
I would like to start the vote of thanks with a quote. It's not about perfect, it's about effort. And when you implement that effort into your life every single day, that's where transformation happens. That's how change occurs. Keep going. Remember why you have started. I hope this quote adds a content to this session. With this quote, I would like to thank the people who have helped me to organize this program. To start off with, I would like to thank my dear principal, who is an encouraging pillar of support, Dr. Kodai ma'am, who has been throughout the session and who has helped me and the students to have empowered with the knowledge of PCOD. Thank you so much, ma'am.
Thank you.
And respected Dr. Tanuja ma'am, it's my privilege to propose a vote of thanks to a wonderful mentor and a doctor. The way you have explained was so simplified, and it is more with the layman's knowledge. Okay, and the phrases which you have used, okay, though it may have some doctoral content in it, but the way you have conveyed to us, it's more with a layman's process. And we are very much thankful to you, ma'am. And the points which you have covered, the one and only thing which touched my soul is everything is in your hands. Everything is in your hands, which you have stressed it again and again, which will boost our students like anything. And what we have to eat, what are all the colored foods, and what are all the healthy foods, which foods we have to avoid, and the exercise, which is very much useful, and the importance of yoga is being highlighted through your speech. And with this, I would like to thank Dr. Tanuja ma'am for gracing the occasion. And I would also thank my own team, Amudini, Sai, Sneha, for being a pillar of support throughout all my ventures. And at last, I would like to thank the students who have come here to grace the occasion. I thank you so much for everyone who have come here. Thank you so much.
Thank you.
Thank you, Kailash. Thank you, ma'am. Thank you.
Thank you so much, ma'am. The students can fill the feedback form, which will be sent in a few minutes. Thank you.
Ma'am, we all can leave the session.
Yes. Thank you, ma. Thank you.
Thank you, ma'am. Thank you so much.
Thank you so much, ma'am.
Girls, we all can remind till the students can finish their feedback. I think I too can leave and you three facilitate the students to finish the feedback.
Yes, ma'am. We'll do that.
Thank you so much, team.
Thank you, ma'am.
Thank you.
Come and call, okay, later.
Yeah.
Yes, ma'am.
Sai, you can
I've posted
switch
the
off the
link.
live stream, I guess.
No, I didn't
Huh?
switch off.
You want to do it
What?
now?
No, no.
Okay, fine.
There won't be using the link.
Yeah, okay, okay.
Can stop cameras if we don't want to.
The link is posted in the chat box, actually.
Okay, fine.
Oh, to whom are you saying?
To you.
Yeah, yeah, I
Oh,
posted.
Sai, can you see if people are replying okay or something?
Uh, in where in the YouTube? They're saying thank you, ma'am.
Yeah. Okay, fine, fine. Can we
We've
leave now?
started receiving responses.
Oh,
Oh,
fine then.
great. Fine. Can we leave now?
We'll see. Wait.
How
I'll
long
wait.
should the form be open?
10 more minutes. 10, 15
15
minutes.
minutes. Yeah.
Okay.
It can't enter into the link.
We can reply on WhatsApp, right?
Yeah.
Yeah. Okay, there is a bonus video. Wait, it's at the home.
What do we do if your link is not opening? We'll ask them to
College
text.
ID. Yeah, we'll ask the class reps
Yeah.
to make a
So
list of all the students who
those who are not
participated.
able to open the link, text us in the WhatsApp or go tell to your respective class YRC representative so that they'll get back to us
Mm.
with the name list and we can give the attendance.
Yeah. Sai?
Yeah.
Yeah, we'll ask the students to fill the form and then tell their class reps, okay? And the class
Okay.
reps should report to us. All these people
Yeah.
participated. Yeah?
Yeah. Leave the message in WhatsApp group as well.
Yeah, okay, I'll do that. Can we leave?
No. I cannot end the thing because the link is there. No, wait for 5 more minutes.
Oh, okay, fine, fine.
If you want to leave, you can leave. I'll and Sneha will manage.
Yeah, okay.
Huh. Sneha, I think shall we end the live?
Yeah, sure.
Yeah, cool. Bye bye.
Bye bye.